Erectile dysfunction is becoming a frequently occurring problem for men. By some estimates, it affects between 40% to 60% of men, with the percentages increasing as men age. No wonder men have so many questions about erectile dysfunction. Since we can't stop aging, the videos on this channel can help us have the best life possible. In today's news update, I want to talk about 6 common questions about erectile dysfunction. If you have any questions about this video, just call or text healthy at 60+ at 609-410-4790. Now let's see what we have today. Here are 6 very common questions that men ask me. Question 1, what exactly is erectile dysfunction? Erectile dysfunction is a condition in which a man is unable to get or keep an erection firm enough for satisfactory sexual intercourse. Erectile dysfunction can be a short-term or long-term problem. Some signs are: 1. Can get an erection sometimes, but not every time you want to have sex. 2. Can get an erection, but it does not last long enough for fulfilling or satisfactory sex. 3. Are unable to get an erection at any time. Question 2. Why is my erection not as strong as it used to be? Erectile dysfunction is a common condition that affects millions of men. It can be caused by a number of different factors, including diabetes, high cholesterol and heart disease, hypertension, obesity, smoking or drinking too much alcohol. When it comes to male erections, size matters. The blood vessels in the genitals are smaller than those in other parts of the body. Problems like blockages or vein dilation will sometimes show up as less firm erections before showing up as something more serious, such as a heart attack or stroke. Question 3. What is the main cause of erectile dysfunction? Erectile dysfunction can be caused by a variety of factors, including psychological and physical problems. It's important to see your doctor if you experience any symptoms, such as difficulty getting or keeping an erection, ejaculating too quickly, or having trouble reaching orgasm during intercourse. The underlying cause of erectile dysfunction plays a critical role in determining which treatment option will work best. It can be caused by many things, such as physical problems, emotional problems, alcohol or drug use, and aging. The most common cause of erectile dysfunction is due to the narrowing of the blood vessels, which restrict the flow of blood to the penis. Erectile dysfunction may be successfully treated with medications, lifestyle changes, or other therapies that improve blood flow. Question 4. At what age does a man stop getting hard? The answer is not simple and typically varies from one individual to another depending on many factors such as genetics and health history. In general, the younger a man is, the better his sexual function will be. About 40% of men are affected by erectile dysfunction at age 40, and nearly 70% of men are affected by erectile dysfunction by the time they turn 70. Question 5. At what age do men need Viagra? Age is a factor in determining when Viagra should be taken. It may be appropriate to start taking it if you are aged 45 or older and have not had any success with other treatments. The age range that makes sense for most men is between the ages of 50 and 75, but every man's situation will be different, so it's important to talk with your doctor about how old you need to be before starting treatment. Question 6. Why would Viagra not work? A common misconception is that Viagra will always work and solve all erection problems. That's not the case, however. Viagra might be ineffective for a variety of reasons. One reason could be that it may have been taken too close to sexual activity, so there was no time for it to take effect. Another cause could be taking other medications or supplements at the same time as Viagra, which can interfere with its effects on blood flow in your penis. There are also some underlying conditions that can make Viagra less effective, such as diabetes, high cholesterol levels, smoking or drinking alcohol excessively, men who are overweight, those who have severe liver disease or kidney disease, and those with certain types of heart failure or coronary artery disease. In conclusion, if you had any of the questions listed above, it is important to talk with your doctor about erectile dysfunction. Ask them if there are other possible causes so that an accurate diagnosis can be made and appropriate treatment options discussed. Talk to your partner about erectile dysfunction. They may also have questions or need support from time to time as well. Never hesitate asking for help when you need it. Okay, that's it for this video. But just one more thing. If you have any questions about this video, just call or text healthy at 60+ at 609 410-4790. Remember, there are many ways to deal with erectile dysfunction. At Healthy at 60 Plus we have a preferred method called nitric oxide therapy. Click the link below this video to see a great explanation of nitric oxide therapy and how it can change your life. To be informed of new videos, just subscribe to this channel and remember to click the bell icon. To view other videos about this same topic, just click on either of these two video links. Thank you for stopping by and watching this video. Remember to contact me with any questions. Have a great day and here's to your good health.